Hello, everyone. Thank you for joining us. Please, can I get a thumbs up if you can hear me now? All right. Thank you, Kate. So, thank you, everyone. Welcome to this American Indian Alaska Native Prevention webinar series. I am your host, Cindy Sago, and today we have Jackie Gray presenting on what is elder abuse and how do we prevent it. So the National American Indian Alaska Native is part of the PTTC network, which also includes 10 regional centers, a network coordinating office, and the National Hispanic and Latino PTTC. We are located in Iowa at the University of Iowa. And for this webinar, in the next couple of days, we'll send out a follow-up email to everyone who attended. This will include a link to the recording, the handouts of the slides, and the CEU request form. Our center is NADAC certified, and we will be happy to provide you with CEU points for the $15 fee. We'd like to point out that we are currently working on adding additional CEU options for prevention specialists, and we'll make that available as soon as possible. So for today's webinar, immediately after the webinar, you'll be redirected to GIPRA evaluation. This survey is just a few minutes to complete, and it asks about your satisfaction with the event. This feedback is critical to our future work, and we value your opinion, and we greatly appreciate your time in sharing your thoughts with us. So going forward, you'll be muted for the duration of the webinar. Please use the chat pod to share your questions and comments as others have been doing, and we'll address your questions at appropriate times during the presentation. So today's speaker, Dr. Jackie Gray, she's a research professor and the Associate Director of Indigenous Programs at the Center for Rural Health and Development, and also at the Department of Pathology at the University of North Dakota School of Medicine and Health Sciences. She is from Oklahoma and of Choctaw and Cherokee descent. She has worked with tribes across Indian country over the past 30 years in the areas of health, education, counseling, and program development. Her research and work with American Indians includes, as we mentioned, depression, elder abuse, anxiety, veterans health services, spirituality, suicide, career counseling, and nutrition. Dr. Jackie Gray has also developed a rural crisis intervention program and an adolescent suicide prevention program in Oklahoma that has been adopted across the state and become the first viable divorced parent education program in Oklahoma. She's a licensed professional counselor in North Dakota, and she was part of the rural health training grant during her psychology internship at the University of Wyoming that has put multidisciplinary terms in rural and frontier settings across the state. So thank you very much, and I will hand on to Jackie.
Thank you, Cindy. Can you hear me okay?
Yes, we can hear you, Jackie.
All right, thank you. Good afternoon, everyone, and thank you for the opportunity to talk with you a little bit about elder abuse and what we can do to prevent it in Indian country. Just some information to begin with. In 2018, people age 65 or older made up about 16% of the U.S. population. And it's estimated that at the current rate, by 2060, they'll make up 23%. With American Indians and Alaska Natives in 2014, there were about 230,000 older American Indians and Alaska Natives, and that's anticipated to almost triple by 2060. And with that increase in the number of elderly, our incidents of elder abuse and neglect are expected to increase along with that growth in population. Some of the implications of this: 90% of elder abuse is committed by a family member. And elders who have been abused are at 200% higher risk of dying than those that have not been mistreated. Nationally, the financial abuse costs older Americans $37 billion per year. And the above numbers are thought to be underreported because of either love for or fear of the abuser. So what is elder abuse? Well, according to the National Center on Elder Abuse generally refers to any of the following types of mistreatment that are committed by someone with whom the elder person has a special relationship. For example, a spouse, sibling, child, friend, or caregiver. Physical abuse, sexual abuse, emotional, psychological abuse, financial exploitation, neglect, self-neglect, and abandonment are included in those types of abuse. So, again, according to the National Center, there are 7 types of abuse that I just listed: the physical, emotional, psychological, sexual, financial, or material exploitation, neglect, self-neglect, and abandonment. But according to Duran and Duran, the colonization or abuse impacting the values and identity of a person, they termed as soul wounding. And Dr. Labori and I did an article in 2018 that really defined spiritual abuse, which is what our elders were calling it. So a little more detail about each of the different types. Physical abuse is defined as the use of physical force that may result in bodily injury, physical pain, or impairment. Some of the types may include acts of violence that we think of, such as striking, hitting, pushing, shaking, slapping, kicking, pinching, or burning. Additionally, inappropriate use of medication, physical restraints, force feeding, and physical punishment of any kind can also be termed physical abuse. Physical abuse may not be obvious or easily visible. Some examples are an elder that was hit by an adult child, or an elderly man with dementia hitting his wife, a daughter who hits an elder stemming from the stress of dealing with his needs and health care. Drug taking or alcohol use leading to yelling or hitting other family members. Emotional or psychological abuse is defined as the infliction of anguish, pain, and I would call this emotional pain or distress through verbal or nonverbal acts. This can include verbal assaults, insults, threats, intimidation, humiliation, harassment, or disrespect. Some of those examples include what we call elder speak, or talking to the elder as if they were an infant, giving the elder the silent treatment, forced isolation, and threats. Some examples that I've been given include grown children moving in with the elder and then drinking, fighting, taking their money, and chasing away their caregivers. Confining an elder to one room with no interaction with the family. Verbal abuse by young family members. Children threatening parents and grandparents that they'll send them to a nursing home if they can't move in and live with them. Not listening when elders speak, and treating them as if they don't matter anymore. Sexual abuse is defined as non-consensual sexual contact of any kind. Sexual contact with any person who has not consented or is incapable of consent is also considered sexual abuse. Some of the examples include rape, unwanted touching, molestation, sodomy, coerced nudity, taking or distributing of sexually explicit photos or videos. We don't hear a lot about sexual abuse in Indian country, but some of the examples that I've been given include grandma being raped by a male high on meth who broke into her house. She was ashamed and would not report or tell anyone, but finally agreed to go to a hospital for an exam. An elderly male sexually assaulted by a caregiver. He wouldn't talk about it. He was ashamed. An elderly woman was raped and killed, leaving an elderly person exposed in their bed. Now, financial or material exploitation is growing. The definition is the illegal or improper use of an elderly person's funds, property, or assets. Some examples include cashing checks without authorization or permission, forging a signature, misusing or stealing money or possessions, coercing or deceiving an older person into signing documents like contracts or a will, improper use of conservatorship, guardianship, or power of attorney. Some examples I've been given include a granddaughter who wiped out grandma's bank account, misusing an elderly person's monthly check and not paying for food or bills for the one that it's intended. The family takes grandpa's personal items. The family took auntie's check. Grandchildren pressured the grandparent to give them money. The family borrowed money and didn't pay it back. A granddaughter and her boyfriend moved in to be supported by an elderly grandmother. This doesn't include the fraud and identity theft that is by someone that they don't know. And as we move on, neglect is defined as the refusal or the failure to fulfill any part of a person's obligations or duties to an elderly or disabled adult. Neglect can include failure of a person who has fiduciary responsibilities to provide care for that vulnerable adult by paying the necessary home care services, or failure on the part of an in-home service provider to provide the necessary care for that elderly adult. Some examples include failure to provide necessities such as food, water, clothing, shelter, address personal hygiene, medication, comfort, personal safety, other essentials included in an implied or agreed upon responsibility to a vulnerable adult. Some examples of that are an elderly uncle confined to home and family wouldn't provide any support to help him. Failing to obtain proper medical treatment for grandma. And this can include transportation. A family locks grandpa in a room at home. Not visiting or taking grandparents to gatherings. And then spiritual abuse, as I mentioned earlier, is defined as the harmful interference with spiritual growth, including corruption of another person's value system. Some examples of that include preventing grandma from attending spiritual activities or ceremonies, the theft of grandpa's ceremonial items to sell or use without permission, and comments or activities which are damaging to the elderly person's spirit, or sexual abuse as a spiritual activity. Many times the sexual abuse is by spiritual leaders. Abandonment is defined as the desertion of an elderly person by an individual who has assumed responsibility for providing care for an elder or by a person with a physical custody of an elder. Some of the signs and symptoms of abandonment include, but they're not limited to, desertion of an elder at a hospital, a nursing facility, or other similar institution. Desertion of an elder at a shopping center or other public location. An elderly person's own report of being abandoned. Some examples that I have been given. The family goes away leaving grandma without food or drinking water in the heat of the summer in a tent waiting for the powwow to begin. Grandpa's not left with any resources for personal hygiene, so he has no way to keep himself clean. Self-neglect is characterized as the behavior of the elderly person themselves that threatens their own personal health or safety. Self-neglect may manifest in an elderly person as refusal or failure to provide themselves with adequate nutrition, clothing, shelter, personal hygiene, medication, and safety precautions. It would exclude a situation in which a mentally competent elderly person who understands the consequences of his or her decisions makes a conscious and voluntary choice to engage in acts that threaten his or her health or safety. Examples include lacking food or basic utilities, refusing medications or hoarding, and other similar types of situations. So what causes elder abuse? Sometimes we hear about caregiver stress, the stress of taking care of that elderly person. And we need to look into, what is related to that stress. Another is our violent society, that we tend to act out in more violent means with the stresses that are currently occurring. A sense of entitlement that children, grandchildren feel entitled to what the grandparents may have. Greed, wanting that money or property or other resources for themselves. Ageism, feeling that those that are older are worthless or have no benefit to society. Power and control, having that power and control over the other person. And many times we see all of the above involved in elder abuse. So why does elder abuse happen? Well, elders are trusting in nature. They're perceived to be easy to fool or con out of what they have. And many of our elders are the only ones in the family with a steady source of income. And it's easy for them to be left in isolation, lacking transportation, or the inability to get themselves to different activities and having to rely on family members or others. So what are the health effects of elder abuse? Well, we see that some of the research has shown that there's an increase in mortality. They die earlier if they've been abused or neglected. There are poorer physical outcomes from any medical treatments. They have increased pain, and the current conditions they're being treated for are exacerbated. There may be welts, wounds, or injuries that are slow to heal or become infected. And they have that increased susceptibility to infection. So some of the financial effects of elder abuse. They don't usually have restitution. Once the money is gone, it's too late to get it back. There's no time for them to rebuild their assets. They're at the point in their life where they're utilizing those assets. There's a loss of choices for the older adult and a loss of independence. They have to rely on others and may have to end up relying on Medicaid or Medicare. And relying on others for financial support when they don't have any of their own resources left. And the intergenerational transfer of any wealth is impacted. And again, they more quickly spin down to where Medicaid is their only options for treatment. Some high-risk situations include people with inadequately treated mental health or substance abuse problems, as caregivers are more likely to be abusive, or even interacting, not being the caregiver, but still interacting with that elder or vulnerable adult. People who feel stressed, burdened, and resentful are more likely to be abusive. If someone has to provide the care for an elderly person and that wasn't more of a voluntary decision, it was pressed upon them, they're more at risk of being abusive. Providing care for that older adult who is physically combative or verbally abusive, especially when we're talking about Alzheimer's and dementia. Because of the fear, the confusion, many times they become more physically combative and verbally abusive to the caregivers. How do we ask about elder abuse? To just ask, have you been abused? We won't get a positive response from anyone, even if they have been abused. But when they were asked about being disrespected, the elders told the stories that many times could be classified as abuse or neglect. And when asked about being bothered, they told stories of sexual abuse that they would not bring up if asked if they had been sexually abused. So, how do we screen for elder abuse? Well, our best practice is that all clients should be screened at intake for elder abuse, determining what kinds of things may be occurring and what risks are there. When we have groups, we need to start talking about these difficult topics like abuse, neglect, financial fraud, exploitation, identity theft. And the potential to catch this provides a potential where we can either catch abuse in its early stage or with that information prevent it from occurring or escalating. So how do we screen? Asking the elder, has anybody hurt you? Are you afraid of anyone? Is anybody taking or using your money without your permission? When we're talking about financial abuse, talking with elders about planning ahead, asking those questions, what do you want done? When would you be okay with going to a nursing home? When would it be appropriate for someone else to handle your money or your finances? Getting into those planning for end of life in terms of what kinds of things do they want to happen so that their wishes are taken into consideration and those have been recorded. Helping them stay connected, making sure that someone is checking in with all of the elders, especially when they are homebound. Being cautious. When someone asks for money, checking it out, not just responding with handing it over before checking into the situation. And then if you're suspicious of something, reporting that so that the proper authorities can investigate and determine if anything is at risk for that elder. An elder protection team is a multidisciplinary team that addresses the issues of elder abuse and is dependent upon the resources of each tribe as to what the makeup is. The responsibilities can include educating the community and doing prevention activities, building collaboration and trust among the different resources available within each tribe for the elderly and their families, providing an empathetic listener as to what's going on and where they may need to have support, implementing an effective method for responding to elder abuse while maintaining confidentiality within that group, that they can meet and talk about it as far as what needs to be done and set up a plan to help keep the elder safe. Reporting suspected abuse and intervening when necessary, and restoring respect to the elderly. Sometimes the elder protection team may do wellness checks when they hear from members of the community about an elder they haven't seen for a while. So the members of the elder protection team, as I said, varies as to each tribe and what resources they have. But due to the complexity of elder abuse and what elders need, what is available, they can include healthcare, family, legal, social services, community caregivers, and others as needed. But you need to remember that the elder is in the middle, and if they aren't involved in the plan, chances are that it won't be effective. Because of the changes as we age, there are more vulnerabilities. Physical changes reduce the ability to conduct activities of daily living and maintain their independence. Things such as health, our vision is poorer, our hearing is poorer, our motor skills aren't as good, and we're more apt to be depressed. Some of the cognitive issues may be difficulty processing information, problem solving, reasoning, having a flexibility in thinking about things, and declining memory. Social isolation contributes to poor health in retirement. Retirement can cause that social isolation, the loss of the spouse, the loss of friends, and the lack of the technology skills to stay in touch the way our society does today, especially the younger members. So some of the levels of prevention are many ways that we can help prevent elder abuse and neglect. There are 3 levels of prevention: primary, secondary, and tertiary. Primary prevention involves the education of everyone about what elder abuse is and how to prevent it. Secondary prevention involves the work done with elders who are at risk and may include a range of preventative measures such as fall prevention or safety scans of elders' homes, and set up ways of preventing exploitation. It may be also helping elders to become aware of some of the scams and things that are happening. Tertiary prevention is how to prevent elder abuse that's already happened to someone before from happening again, which a lot of times this is where your elder protection team may be more involved. The National Indigenous Elder Justice Initiative on our website, that's nieji.org, has some interactive educational modules. They help to identify problems and concerns. The National Center on Elder Abuse estimates that for every reported case of elder abuse, 14 will go unreported. There's very little known about how widespread elder abuse is in Indian country, and there's no infrastructure or coordinated systems currently in place for prevention, protection, and support for the elder. It's also important to understand what constitutes elder abuse. That's difficult, and many elders may only consider victimization as physical abuse, increasing the risk of other forms of abuse. NIJI's intended purpose is that the general consensus that people may not know what constitutes elder abuse, to produce information on how to define and recognize elder abuse in Indian country, to educate everyone on elder abuse and neglect, and learn ways on how to prevent it, creating culturally relevant materials, providing viewers with training tools and information about elder abuse and neglect, specifically materials geared for formal and informal care providers, law enforcement, and the elders themselves. The online interactive modules the first one went live in June of 2016, and since then we've launched 6 others, including one for caregivers, social services, financial exploitation, legal, policy, and healthcare providers. And right now we're working on one on pharmaceuticals, and we're hoping to have that completed this fall. The modules contain information to gain cultural understanding and best practices in the various disciplines and addressing elder abuse and neglect in Indian country. And each one includes aims and learning objectives for professionals working closely with Native American elders. It has ways for professionals to identify potential signs and risk factors for elder abuse and neglect, and how to report suspected abuse to proper authorities. Also, it includes the culturally appropriate practices, such as the use of language while working with Native elders, and all of those things that will help the professional address the concerns in a respectful manner which adheres to Native American traditional beliefs and practices. The current training, as far as the current training modules, they're located, as I said, on the NIJI website. We recommend that users watch the elder portion first that goes through an introduction to all of the other modules. The completed trainings, again, social services, financial, policy, caregivers, healthcare, and legal. And at the end of completing the module, people get a certificate of completion that they can enter their name and the date and print out for their files. There are a lot of references here if you'd like to utilize them as in addition to resources. And this is our contact information. And at this point, I'd like to open it up for questions. Cindy, have any questions come through?
We're just
on
waiting for
chat?
people that are typing. Please type in your questions and we will get to them.
All right. there were so many things to cover that I tried to just kind of hit an introduction to everything, but there are lots of resources and materials on our website, and we would really, if people have questions, they can send them to info@niji.org, and we'll respond to them and get the information right on out to you.
I see some people typing.
Yeah, we have found really talking about disrespect and what that means with elders can get us a lot of information. Okay, Darcy, I'm glad you'd found this and already have gone through the modules. Maria's asking, what is your suggestion for elders who are hesitant to report their family members and don't want to get them in trouble? One of the things that we're really working on, Maria, is restorative justice, because this is what we hear from the elders that they really want. And restorative justice approaches are really dealt well. We have with the multidisciplinary teams that can come together and come up with an acceptable plan for how to address what's going on. Maybe the caregiver needs respite care. Maybe they need to get the elder to more secure housing. What kinds of things need to take place, and by including the elder in all of that decision making, they have a plan that's more apt to be acceptable. And then if that doesn't work, or if people don't follow through, then they're more apt to go ahead and do something. But there is a real fear because they love the family member and they don't want to see them get in trouble, or because they're afraid of retaliation by someone, that they don't want to go through the legal system. Most of our elders haven't had good interactions with the legal system, and so they don't necessarily trust it. So finding things, multidisciplinary teams. There's a program out of Arizona that does kind of a mediation where a social worker works with the family rather than a whole team to kind of come up with a plan and to connect them with resources. There are different frameworks that tend to include the family in the planning, include the elder in the planning, and that seems to be more effective. So thank you for your question. I do a lot of presenting with Department of Justice, and they're really focused on prosecution. And I'm really focused on restorative justice, that we need to find ways to address the problem. Why is someone doing things in a certain way? Do they not know better? Are they stressed out? Do we need to get the elder in a safer place, still around family and friends? So, senior housing or something like that. Those types of things are really helpful in trying to address some of the issues with our Indigenous elders. Are there other questions? I can see that some of you are typing. Okay. Brian, you may have spoken on this and I just missed it, but did you know how often abuse is found in the nursing homes, if any? I know that the reported abuse tends to be higher in the nursing homes, and a lot of it may be related to the question that Maria had, that they don't want to report about family members and things that have happened in the home. But we really don't have numbers. And probably because of regulation and things like that, there is more data about what goes on in nursing homes. But as far as natives, we don't have much data at all. And we're working with tribes to conduct surveys within their tribes of their elders with our Native Elder Maltreatment Survey, and then we'll analyze the data and get that back to the tribe so that you can make use of that in your planning on how to address elder abuse and the types that are occurring in with your reservation. Okay. Antoinette, are nursing homes normally acceptable to cultural trainings? Nursing homes off reservations that serve tribal elders. I think that's a matter of trying to work with the nursing home. There are ombudsmen that can help to address issues and things like that in the nursing homes, and working with that ombudsman and suggesting appropriate cultural training may be helpful in trying to get more of that into the nursing homes. Because we have so few nursing homes on the reservations, I don't work a lot with the nursing homes, but I do know the ombudsman program is one that we can really work with. Benjamin, are tribes open to reviews by your organization regarding obtaining statistics and gathering information? I realize that there are hundreds of tribal nations in the United States. The way we work the survey is someone from the tribe initiates that by getting a resolution from the tribe or whatever their research review process is. And then they send that to us along with the number of elders they need to survey. We send them the surveys. The tribe collects the data. We can do a training on what they need to do, but we send materials and everything about how those interviews are to be done, and reporting and things like that. And then once the surveys are completed, they're mailed back into us. We scan them in, clean the data, set it up, and send it back. And then once we've finished our cycle, we'll do an aggregate of all the tribes that have participated and do a comparison of each tribe with that aggregate. Some tribes choose to participate, others think it's too sensitive and don't. Okay, Moria, what can we do for our Native elders that we suspect have experienced abuse as children in Reformation schools that are now experiencing dementia and tend to lash out to non-Native caregivers? Again, those with dementia tend to lash out at even Native caregivers. But I would say in that situation it would probably be more difficult. Some of that includes utilizing cues and things like that can help to reorient them. Working to shift, as with small children, you shift their attention and things like that to where they're focusing on something else. Sometimes can help that, but I would think getting some training on sensitivity around those experiences and being able to address, how they're still safe in the current environment, and working with people that have more experience with that. I I haven't done a lot with the dementia and things like that. We're going to be working on some things on that in the next year or two. So I'm hoping to have more information later on. It's really hard when you're trying to cover everything and you have so little to do it with, but we're trying to add more and more to what we're able to do all the time. How are tribes and elders successfully dealing with family members who continually steal or financially abuse elders? I know we had 16 mini grants through our innovation program that we were running, and one of the programs developed a board of guardians where when things like that are going on, that this board can go to court and get conservatorship if the elder is no longer able to manage their funds and the family's taking them instead of managing them. If the elder is still competent to handle their own funds, then it may be setting things up to where bills are automatically paid out of their account, and that they don't have a lot of cash or other things available that others may be able to exploit. So those are a couple of things that can be done. There are others. Does your organization work with state adult protective services regarding statistics and cultural competency? We've kind of had our hands full just trying to work with tribes, because right now, even elder abuse codes of the 573 federally recognized tribes, only about 100 of them have an elder abuse code on the books. When we first started 8 years ago, there were only 40. So, there's a lot of work that needs to be done, and, we're open to working with state. When we were doing some training in Alaska, because the state of Alaska does the investigations, we had people from their office in the trainings that we did where we talked about cultural competency and things like that. So we do try to include them where we can, but our focus has been working with the tribes. Okay, thank you, Darcy. She says she works for the senior center on their settlement, and they have a program that can step in when someone reports financial abuse or steals from an elder, and that program will step in and take care of the finances for the elders. And that seems to be helpful. Thank you, Darcy. Do any of the rest of you have resources or questions? This has been really good as far as the types of questions and the sharing of resources coming in. It's a difficult topic, and we're just now starting to address it with tribes, and there's a lot of work to be done. So we try to, if a tribe contacts us and wants to know about something in particular, we try to connect them with another tribe that's already doing that, so that they can get those ideas and how it works and what the different things were that tribe ran into as far as lessons learned and things like that, to where it helps in trying to get their program started. In fact, that's where our guide on our developing an elder protection team came from. Is we had a tribe that wanted to develop one, and we connected them with someone that had had an effective one for 20 years, and they allowed us to listen in and take notes and put together the guide as a result of that. Thomas Ryan, Tatanka Counseling Services of North Dakota. Darcy, thanks for the information. In one particular situation I was thinking about is an elder whose family is stealing physical items from their house to sell. Police say they need evidence to be able to do anything, and since there's no evidence, and since the theft occurs when the elder is away from the house, the stealing continues. That's a difficult one. I know we have some reservations that have elder housing areas that are gated off, and unless the elder is there, visitors or anyone else isn't allowed in to see them or to go to their home. So there may be things that need to be done just as a general protection. But sometimes discussions like this can help to create ideas that will help. Thanks for bringing all of this up. Darcy says they have a problem there too, and the police department says the same things to our elders. It gets frustrating and wish there were more the police can do to help the elders because it's not right. One of the things that you might consider, the Anadarko Agency in Oklahoma has a program that they initiated, and it's strictly on a voluntary basis. It's not covered by any of their funds or anything, but the BIA Social Services developed a list of at-risk elders, and each shift, each officer for the BIA police takes 3 or 4 names, and they do friendly visits. And these friendly visits, they stop by, say hi to the elder, maybe have coffee with them or something, and get to know them. The elders look forward to it. It gives them some social interaction. It reduces fear of the police. It lets people know that the police are around and checking in on the elder, and helps to reduce those types of things happening. And those happen on an irregular basis. So, it's not like they say every 3rd Tuesday the police officer's dropping by. So programs like this, we can get you more information. It's called Operation Golden Shield. They also do Thanksgiving dinner, and they have senior angels at Christmas and senior sweethearts for Valentine's Day and things like that, to where there's that interaction between social services and the police and the elders. So that kind of thing, that community policing type of thing, having that presence can help to really cut down, because then people are aware that the police are dropping in and the elder is getting to know them and feels more comfortable with them being around. It doesn't address those things that are already gone, but at least, it kind of gets that presence out there. Anything else? We're coming down to the last few minutes we have scheduled, so anybody has the burning question that they can type in now? We're trying to get funding to do some evaluations on some of these tribally based programs that have been started, so that we can get them established as evidence-based programs. And that way, people may be able to get funding to implement it in their area. And Antoinette was asking the name of the program. That's Operation Golden Shield out of the Anadarko Agency in Oklahoma. It's with the BIA. have to stop about and think about some of these things. Covering a variety of different areas, sometimes it takes a few. I'm getting older. It takes a few minutes for things to come to the surface.
All right, it seems like we are close to finishing. I just want to say thank you, Jackie, for sharing your experience and your resources. Thank you to everyone for joining in this webinar. If you have any more questions and comments, you can reach out to me. My email is in the notes box below, cindy-sego@uiowa.edu, or also reach out to Dr. Jackie Gray at info@nieji.org. Before we close this webinar, just want to remind you that in the next few days, we'll send out a follow-up email to everyone who attended, and that will include a link to the recording, the handouts, and CEU request form. And also, as you close out this webinar, please fill out our GIPRA evaluation form that you'll be redirected to. It takes only a few minutes and asks you about your satisfaction with the event. This feedback is critical for our work and we value your opinion. So thank you so much for doing that in advance. So if there are no more questions, we will be closing the webinar soon. Thank you, everyone. Thank you, Dr. Jackie Gray.
Thank you, Cindy. I've enjoyed it. And thank you for everyone for participating in the discussion.